Right, Andy, we're talking about heart disease this morning. Heart disease is the leading cause of death for women in Canada and the second leading cause of death for men. Yet most people do not realize they have at least one risk factor. The good news is there are some simple ways to reduce your risk, like screening. Patient care pharmacist Agusha McGrath is here now from London Drugs with how your pharmacist can help. Good morning to you. Thank you so much for being here again.
Thank you so much for having me.
I'm really amazed that London Drugs is offering something like this. So tell me what it is. So we're talking about the Healthy Heart Clinics.
Well, just reading the statistics that you had, it's absolutely staggering. If you think about patients with blood pressure, high blood pressure or cholesterol, they don't have any symptoms. So that's why London Drugs has these clinics to really help empower patients and give them that information. So in terms of the test that we do, it is a blood sample test that we do in the pharmacy with the patient. We will test patients' total cholesterol, their HDL, which is their good cholesterol, and glucose, and that's part of the puzzle. And then we'll do a full risk assessment with them to try and see how do we manage the risk factors and decrease their chances of developing heart disease over the 10-year period.
Over the 10-year. We should mention that this visit that you're talking about lasts 45 minutes.
It really is.
This is an extensive amount of time.
It's a one-on-one consultation with a pharmacist. It's comprehensive in terms of the information that the patient gets. It is unique and tailor-made specifically to that patient's risk factors. So every patient is different.
Of course.
And that's why we like to spend that time to get to know the patients a little bit more, have a look and see what are their modifiable risk factors. So what do they have control over and what can we guide them through in terms of changing that?
Sure.
And then should something come out in this clinic, we work collaboratively with their healthcare professionals. We'll make recommendations, we'll send the information across to the doctor, and then the patient has the best experience.
Absolutely, and their health team is working together, which is so great. So let's look at some examples. So say, for example, you have a patient that might come in and may not reveal right away, but after, say, talking with you for a few minutes, they might be a bit more comfortable and reveal, for example, that they're a smoker. So that's a modifiable risk factor,
Exactly.
right? Okay.
So we have things that, like in terms of this clinic, there's the modifiable. So, for example, smoking, exercise, weight loss. Then you have, if you've got high blood pressure, high cholesterol, all of those are manageable risk factors. Then you have the non-modifiable that really patients can't do anything about. We can't change our age.
Right.
We can't
as
change
much as we'd like to.
And then, for example, male and female. Then you've got family history. All of those are non-modifiable. But this test empowers patients. It gives them the knowledge of where they currently are and what they can do to have better health outcomes down the line.
Absolutely. And this is concrete information. So you're actually doing a blood test right there.
Yes. So the patient comes in and we will take a small blood sample.
What does that look like? So how would you do that?
So what we would do is we have a lance setting device. We'll get the patient to clean their hands with alcohol swabs, lance setting device. We'll draw a sample of blood. And
that's basically a finger prick is what you're saying.
Yes, finger prick. And then that goes into the machine. The machine gives us the results in 2 minutes. And then we'll have total cholesterol so that we have an idea of if the patient is a low-risk patient or a high-risk patient. Then we'll look at their good cholesterol, because the higher the good cholesterol is, the lower the risk is that you have clogged arteries. And then we'll look at glucose level as well, just to determine if a patient has pre-diabetes or whether they have pre-diabetes, as I said, and we'll do blood pressure as well, and then that together with all the rest of the risk factors gives us an assessment of what their chances are of having a heart attack or stroke in the next 10 years.
There you go. This is fantastic information for the patient. Thank you so much for telling us all about it. You can go get this done at London Drugs. Thank you.
Thanks, Leah.